Good evening, everyone. My name is Chandra Sawyer. I am the Healthcare Wellness Specialist here at the National Health Insurance Authority, and I would like to take this time to welcome each and every one of our participants for logging on to our July installment of the Beneficiary Educational Session. This evening, our session is intended to focus on the electronic health records, which is a feature that is afforded to all of our beneficiaries that are part of the National Health Insurance Program. And so this evening, we want to focus on a few aspects of the NHI Bahamas program before we introduce our guest speaker. And who are we? At the National Health Insurance Authority, our vision statement is to lead the way in providing access to affordable, quality healthcare that Bahamians deserve. Our mission statement, we are transforming the healthcare system upon which the future well-being of Bahamians depend by putting patients at the center of every decision that we make. And our core values at the National Health Insurance Authority, we are passionate, we are progressive, we focus on partnerships, we are individuals of integrity, we are an organization that's integrity-driven, and we respect and honor our beneficiaries by providing care and respect in all aspects of our service. So what is our focus at the National Health Insurance Authority? As a part of the NHI Bahamas Wellness Program, we are dedicated to creating a platform where our beneficiaries, as well as the public at large, are encouraged and educated on adopting a healthy lifestyle. And we want to encourage our beneficiaries, as well as the Bahamian public, to incorporate healthy practices such as regular exercise, healthy eating habits, adopting healthy eating habits, and focusing on your mental, emotional well-being, as well as your spiritual well-being. We want each and every Bahamian to understand the importance of maintaining a healthy lifestyle. This will ultimately lead to the enhancement of our overall health, as well as our well-being. You know, health is wealth, and that is a popular saying that is within the health and wellness community. And so here's where we are now within the, my apologies, here's where we are now in the NHI Bahamas program. Here's how we are making a difference. At NHI, we are providing access to affordable quality healthcare since our inception in 2017. And we have worked hard within the last 5 years to deliver on our vision and to advance the path to universal healthcare coverage. Here are a few aspects or focus points as it pertains to the National Health Insurance Bahamas program. So we have implemented digitally enabled care, and this is where our beneficiary education or information is documented in an electronic health record. And this enables our providers, as well as our beneficiaries, to access or tap into the telehealth system for applicable visits. Our enrollment over the last 5 years, we have enrolled over 126,000 Bahamians, as well as Bahamian citizens, into our program. Our demographic is very diverse. The enrollment of our beneficiaries consists of Bahamians from more than 17 islands, 5,700 Bahamians under the age of 5. And so we refer to them as a part, they make up some of our pediatric population, and 14,000 plus of our beneficiaries are over the age of 65. And so we call them our precious pearls. We have an expansive provider network, which consists of 107 physicians, 63 primary care physician facilities, 16 lab providers, and they extend over 5 islands throughout the Commonwealth of the Bahamas. We also complete a patient satisfaction survey, and at our last results revealed that 96% of those patients or beneficiaries, as we refer to them, enrolled in the NHI Bahamas program are satisfied with the service that they are receiving from the program. So this evening, we want to focus on the digitally enabled care portion of our program. at the NHI Bahamas, and that is the access to the patient care portal and electronic health records. We have our lead EHR specialist by the name of Sabrina Sweeting, who will be facilitating the session. She has a vast amount of knowledge as it relates to the patient portal, the electronic health records, as she is responsible for not only educating our beneficiaries, but also educating our providers, as well as the staff of our providers across the facilities amongst the 5 islands in the Bahamas. And so without further ado, I want to take this time to introduce Sabrina Sweeting. At the end of her presentation, we will open the floor for a question and answer session. You are encouraged to submit your questions in the chat, and the questions will be read to Ms. Sweeting at the end of her presentation. Once again, we hope that you enjoy the presentation, and thank you again for joining us.
Thank you, Chandra, and good evening, everyone, and welcome to this evening's presentation. I am indeed honored to be presenting to you the topic Electronic Health Record, or EHR. So what is the Electronic Health Record? The EHR is a digital version of a patient's paper chart. EHRs are real-time, patient-centered digital records that make your health information available instantly and securely to authorized users. EHRs can contain patients' medical history, diagnosis, medications, treatment plans, radiology images, as well as laboratory and test results. The EHR provides secure sharing of patient information. One of the key features of an EHR is that patient information can be shared with other providers across healthcare organizations. EHRs are built to share information with other healthcare providers and facilities, such as laboratories, various specialists like your obstetrics and gynae, your internal medicine or pediatricians, medical imaging facilities, as well as other emergency care facilities. So they contain information from all clinicians involved in a patient's care. Having an EHR results in better healthcare. And what do I mean by this? With an EHR, all of your health information can be in one place. A network EHR system can give providers more accurate and complete information about your healthcare, so you receive the best possible care. Electronic health record also increases patient participation. Providers and patients who share access to electronic health information can collaborate in informed decision-making. Patient participation is especially important in managing and treating chronic conditions such as high blood pressure or hypertension, diabetes, or like we like to say sugar, and obesity. With the EHR, providers can give patients full and accurate information about all of their medical evaluations. Providers can also offer follow-up information after an office visit or hospital stay, such as self-care instructions, reminders for other follow-up care, and links to web resources, such as our educational health web resources. Next slide. The patient portal and the health and online wellness, HELO for short, mobile app are two features within the electronic health record that is most beneficial to you as a beneficiary or patients, but we like to call you our beneficiaries. The patient portal is a secure, convenient, and easy to use website that gives you round-the-clock, 24-hour access to your health information for anywhere with an internet connection. Using a secure username and password, patients can view health information such as lab results, access health records, view visit summary, access health education materials, view current medication, and receive messages from your physician. Next slide. This video that Chandra is about to play is going to show you how you can access your patient portal and the Hilo app.
As part of ongoing efforts to provide the highest quality of care, we are pleased to introduce you to Hilo. This powerful technology will help us together to ensure you are involved in the management and improvement of your wellness. There are two ways to access your medical information: the patient portal and the Hilo app. Both are free, secure, and convenient, putting you in control of your own health care. The patient portal is a secure online website that helps you access your health information, such as viewing upcoming appointments, medications, and viewing or printing your visit summary. It makes managing your health easier and more efficient. To gain access to your patient portal, simply sign up by providing us an email address in order to web enable you. From there, you will be able to securely log in with your username and password and gain access to your personal health record and other helpful features from any computer or device with an internet connection. Now, if you are one of 2 million patients accessing your information online through the patient portal already, or even if you're not, you may be wondering how an app will be useful to you. The first benefit is accessibility. On your smartphone or tablet, the Hilo app will let you see the information without having to type in a URL, a username, and password every time. When you set up your account, you verify your identity and then configure a 4-digit PIN that is easy for you to remember and enter on your device. If you have more than one account for yourself or your family members, these can be linked together to make it easy for you to manage everything in one place. Let's look at the other things this free app can do for you. Since you have the Hilo app, this appointment will show up in your phone so you can set it to remind you about the appointment, and it can direct you to the office. If you have specific things you want to discuss during the visit, use the notes section to keep a list for yourself. After the appointment, you will be able to see your visit summary anytime you need from your phone. As part of ongoing efforts to provide the highest
Thank you, Chandra. So as you saw in that very quick video, that there are two ways to access your medical information. So what is best for you as a beneficiary all depends on which device you are more comfortable with. For those of you who have a desktop or laptop, you're able to access your patient portal in the comfort of your own home, or even at work, or even taking your laptop on Sanders Beach and relaxing to be able to access your medical information. Or for some of our more techie beneficiaries, you may enjoy having your medical information easily and readily accessible while you're on the go through your mobile phone. So you may enjoy using the Hilo app. Both features allow you to stay informed and take charge of your health. Telehealth. The use of telehealth visit option has increased tremendously over the pandemic. Telehealth video visits are a convenient option which allows beneficiaries to have an appointment with their medical provider in the comfort of their own home by using their mobile phone, tablet, or computer. This video that Chandra is about to play will show you the 3 ways how you are able to access a telehealth visit.
With just a few simple steps and the right technology, you'll see how powerful Hilo telehealth solutions can be, delivering the quality of an in-office visit with the ease and safety of being online. As a patient, you can now launch a televisit by clicking on a link in an email or a text sent to you by your doctor. No download or login is required. You may also start your televisit from the Hilo app. Upcoming appointments will be indicated in red. Touching your appointment wheel will bring you to the dashboard listing of all your current appointments. To start a scheduled appointment, touch the small camera icon and then touch Start Televisit. This will put you in a temporary waiting room, the virtual waiting room. When your provider joins, you'll be able to see and speak with your provider on the Hilo app. Patients can also join a televisit through the patient portal via a web browser. You'll need 4 things for a successful televisit. 1. be able to sign into your patient portal, be web-enabled that is. You must have a camera, have a speaker, and have a secure, reliable internet connection. Once your televisit is set up, you'll receive a notification reminding you to sign in for that televisit. In the appointment area on the left, you'll see Join Televisit. Click there to start the televisit. Your provider may have requested that you answer a few questions before your televisit begins. Click Submit Questionnaires to provide your answers. In the Vitals section, do your best to fill out the fields recommended by your provider. If you don't have the information, just leave them blank. Once you're ready, click Next to start your visit. Your computer will then perform an automatic system compatibility check on your browser, speaker, camera, microphone, video connection, and bandwidth, all to ensure and secure the successful televisit. To the left of your screen, you may see a pop-up menu. If so, click Allow to permit the browser to use your microphone and camera. On the right, you'll see green circles with white check marks inside. Then click Proceed when it appears in the bottom left part of your screen. Finally, click Start Televisit. You are now in the virtual waiting room. Your provider will begin the visit when they are ready. Simply wait for them just as you would if it were an in-office visit, or follow any other processes that may have been recommended for your visit.
As you can see from the video, either by using a mobile, tablet, or computer, telehealth visits are secure and hassle-free. I want to add that there is no additional cost for a telehealth visit for NHI beneficiaries. And these are great options, especially for our patients or beneficiaries who may have mobility issues, or for beneficiaries who live in the Family Islands and want to be seen by a physician at one of the NHI facilities that are on any of the other islands. So this is telehealth is very convenient for patients or beneficiaries in that it gives patients in-office quality without that trip to the office. Patients with a smartphone, computer, and internet access can meet their provider while at home, in the office, or traveling. I want to thank you for your attentiveness during this session, and I will turn it over to Chandra for questioning.
With just a few simple steps and the
Good evening again, everyone. Thank you, Ms. Sweeting, for such an informative session. I know we just touched the surface of what the electronic health record and the patient portal access is and what it entails and how it is so beneficial to our beneficiaries to ensure that they access such a vital aspect of our program. I have a few questions. I've received some private questions, and there's a few that were also placed in the call chat. But a question that came to me, Ms. Sweeting, if I do not have a laptop or a PC at home, can I still utilize the telehealth visit feature?
Yes, you can. Even if you do not have a laptop or a desktop at home, you're able to have a telehealth visit with your physician using your mobile phone. A text message, it will be sent to your phone. You just click onto the link. The only thing that you need to either have access to Wi-Fi or you need to have data on your phone, but you are able to access a telehealth visit using your mobile phone.
Okay. During your presentation, you made reference to a term, web-enabled. And then I know that a question came through the chat as it relates to the account and knowing how to access the electronic health records. But what does it mean to be web-enabled?
It seemed like such a funny term to say web-enabled, but it is a simple process for you to be web-enabled. All you need to do as a beneficiary is either call your NHI facility, your physician, or when you attend your clinic visit, you're going to update the staff with your email address. Once the clinic staff has your email address, they will be able to web enable you. And web enable means that you will now have access to your patient portal and will be able to have telehealth visits. One thing though, I know for some of our beneficiaries, we see this in many of our senior citizens, you may not have an email address. So we encourage you, let's say if you live with your adult child or adult grandchild, you are able to use their email address so that you can be web enabled and be able to access your patient portal and have the telehealth visits.
Okay, thank you for that. That is very good. In terms of, so I noticed that in the chat, someone mentioned that they just downloaded the app and the app is asking them for a practice code. Can you speak to that?
Oh, great question. And congratulations on downloading the app. So with the Hilo app, there is a practice code, and that practice code is for each individual facility. So each of your NHI clinic has a practice code. You are able to either, if you have access to that email, that original email that you received regarding congratulations, welcome, you now have access to your patient portal. If you scroll all the way down to the bottom, you would be able to see the practice code. Or not, you may have so many emails in your box. Simply tomorrow morning, whichever facility you're with, call the staff and you can ask them to give you their facility code.
Thank you for that, Sabrina. Another question. Can you explain to us what all information the patient would have access to via the patient portal as it relates to their electronic health records or their medical records?
Definitely. So with the patient portal as well with the Hilo app, you will have access to your lab results, health records, your medical summary. For even our pregnant beneficiary, you'll have access to your OB information, your obstetrics information. You'll be able to look at your current medication, get reminders and receive messages from your physicians. You're also able to see any recent and upcoming doctor's appointments from your patient portal or Hilo app.
Thank you very much. Thank you. So am I able to make my doctor's appointment through the portal, Sabrina?
So that is one thing that you're not able to do with the patient portal. So ideally, when you want to make an appointment, you're going to have to call their facility so that they can set up an appointment for you. So that's one thing you're not able to do is making an appointment through the patient portal at this time.
Okay, that's definitely very helpful. Sabrina, you're such a wealth of knowledge. I feel like we may have to do another session. I think this may be the final question that I would have received for today. If I decide to be reassigned to another provider within a different facility, will my new physician have access to my medical records?
So yes, like I shared earlier, the electronic health records allow for secure information sharing of your patient information. So let's just say you want to move from clinic A and be reassigned to clinic B, the physician and only the physician under their username and password, they will have access to your medical information from the previous physician, but only the physician would have that access.
I like that that you emphasize that only the physician will have access to that piece of information. I know with living in this electronic age, there's a big concern about security and information being held confidential. So can you speak to the level of confidentiality that the electronic health record system within the National Health Insurance Bahamas program, how secure is that information that would be captured in the electronic health record system?
As Chandra and I know, protecting the privacy and security of health information is top priority for the National Health Insurance Authority, as well as our NHI physicians and providers. The EHR system that we use The vendor is eClinicalWorks. It offers best-in-class mechanisms for protecting the privacy and security of health information. Certain mechanisms such as user role-based access privileges, for instance, like I mentioned, in the EHR system, not every staff has free-for-all to access anything, any and everything within the medical record. Within the system, according to each role, they are given certain permissions and access to certain areas in the system. For instance, front office staff will not have the same access as the registered nurse, as well as the registered nurse would not have the same access as the physician. Of course, the physician has overall access of your medical information. So there are also strong passwords. We have audit trails where you're able to see who has attempted to access anything within the system. There's also maybe a little big technical word, encryption of data. So as to when data is in transit, you have the privacy and security features that is enabled throughout the system.
That's so important that you tapped into the security features and you were able to provide that information to all of the participants on the call. And so we hope that as we post this information on our social media pages, particularly on Facebook, as well as our YouTube channels, that information is relayed to the Bahamian public so that they can know what the electronic health record system is, the patient portal access, know how safe and secure it is, and how it's actually a benefit for us to be able to use. Because like you said, you can access it at your fingertip while you're driving, if you're parking, or if you're even traveling to another physician. It makes it easier for you to have that medical information readily available to you so that there's no delay in your healthcare coverage as well as your healthcare service. In addition to the electronic health records, Sabrina, being used within our network, and I think this question is very spot on. This is placed in the chat. Can health information from outside of the country be added to a beneficiary's electronic health record as well as their patient portal?
For right now, because there's a mechanism called the External Health Exchange that we are setting up within the EHR system network. So at the moment, only the NHI facilities have the access to this External Health Exchange. It may be in the future as NHI develops and evolves that we would have that External Health Exchange with international or clinics and facilities outside of the Bahamas. But for right now, the External Health Exchange Program network, that only involves the NHI, our NHI facilities and physicians.
Thank you, Sabrina. That is very good for us to know. And so again, that emphasizes the importance of beneficiaries tapping into this benefit, this electronic health record and patient portal access so that they can have that information and be able to give it to another provider that they would have, that they probably would seek additional medical care and healthcare coverage outside of the NHI network. I do
want to add, Chandra. So even though, let's say, Baptist Health is not attached to the External Health Exchange, remember that the physician, you have access to your patient portal or your Hilo app that has all of your medical information, all of your lab results, all of your diagnostic imaging. So you're able to take your phone when you go to Baptist Health or Cleveland Clinic to see a physician, and they are able to see, you can share that information with them. You can even print off the information from your patient portal or send your information from the Hilo app to print.
Hi, Sabrina. I think we may have lost you. And
Good evening. I can hear you.
okay, my apologies. My internet just went out on me. But I think we had left off, Sabrina, where you were talking about accessing our the patient portal and being able to print your records.
Correct. For instance, where you brought up the point, if the patient, just because any facility that's outside of the NHI network, whether it be in country or out of country, and a patient wants to be seen by another physician, if they have access to their patient portal or the Hilo app, they are able to share this information, their medical history, lab results, any imaging, current medication with that physician by the patient portal or Hilo app. They're even able to print off that information, that patient information from the patient portal or the Hilo app and be able to present that to any physician or clinic that is outside of the NHI network.
Thank you for that, Sabrina. Again, this information, I think it's so important, and it is very important for us at the authority as well as our beneficiaries to have access to this information, to be constantly reminded of this information. And so we are encouraging all of our beneficiaries that are on the call this evening, please go out and share this information to your family members that you know that are part of the program. If you have any colleagues that are contemplating enrolling in the program, please encourage them to enroll, even if only for this feature, because we know that having access to our medical records, it's so important to be able to have that at your fingertips, to always be able to know your numbers. As we seek healthcare, as we go from maybe different providers, having that information on hand is definitely important, because you don't want to be always going back, whether it's doing diagnostic testing just to be able to go through that proper channels for diagnosis. Sabrina, can you expand further on the practice codes?
No problem. So when you are going to download the Hilo app, so the Hilo app is accessible either through Google Play Store or the Apple Store. When you download the Hilo app, it's going to ask you for a 4-digit practice code. That code is individualized for each NHI clinic. So if you do not have at your fingertips the initial email that shows you welcome to the patient portal, if you do not have access to that email at your fingertip, because at the bottom of that, if you scroll all the way down to the bottom of that email, it would actually give you the clinic practice code. If you do not have that email access to you, you can easily call tomorrow morning whenever your clinic opens up. You can call the clinic and you can ask them to give you the code. And that would allow you to be able to access and open up the Hilo app.
Thank you for that, Sabrina. Thank you for expanding on it again. I think it's definitely important so that we could know, for those of our beneficiaries who are not using and utilizing the electronic health records, now is the time to utilize it. And now is also the time to encourage, whenever you go to your physician again, you could now speak to the knowledge that you would have gained in the session this evening and encourage your providers to document, to properly and accurately document, so that you can have access to your health records. Sabrina, if you have any last words, any final words, any final takeaway points, anything that you would want to re-emphasize or reiterate, we are gonna give you the opportunity to do that. I don't see any other questions coming in through the chat. I think we would have touched on all of the questions and concerns that would have been addressed. And so anything that you think that that's any valuable piece of information that we can walk away from, can you use this time to just reiterate that as we wrap up our session?
No problem. I just want to re-emphasize the point of being web-enabled, because in order for you to be able to access the patient portal or the Hilo app, you're going to have to be web-enabled. And what does that mean? That means that you're going to have to provide your NHI facility with an email, a valid email address. Once you provide the facility with an email address, they'll be able to web enable you. So if you know that you've changed your email address, maybe you've been a beneficiary for, the past 5 years, but let's just say last month or even a year ago, you changed your email address, make sure that you call the facility or at your next clinic visit that you update the facility with the email address. Once they have your email address, they web enable you. You would receive an email like the video showed that would give you access to your patient portal. Also in that email, it would have the practice code at the very bottom of it for you to be able to access or download the Hilo app. Again, I know for many of our beneficiaries, you may not have an email address, but if you do have a mobile phone, that means you set that up with somebody's email address. So if you would have used, let's say, if you in a household with Grammy, mother, daughter, all of them are adults, you are able to use that email address to be able to activate your patient portal and enjoy using the Hilo app, and also to enjoy using the telehealth visit. So a key thing is you have to be web enabled. So you have to notify the facility of a current valid email address. Thank you.
All right, so Sabrina, there are a few questions that came through, and I think it's definitely important for us to address those questions. A question has to do with addressing information if a beneficiary was transferred or was reassigned to a different facility or a different provider. This question speaks to the beneficiary transferring from one clinic to another in February of 2022. However, the information or their electronic health records cannot be located. How can they now go about and address this issue and have their electronic health records updated?
So can you repeat the question again? I just wanted to get the date. It was February.
So the beneficiary transferred from one clinic to another in February 2022, but the information cannot be found at their current provider or their current facility. They want to know how can they go about addressing the issue and having it rectified so that their records can be updated.
Okay, just want to note, as you know, as we enrolled or bring on new facilities, each facility then would implement the electronic health record system. So in order, this may be one of those individual questions that I have to address because it could be a couple things. It could be at the time when the patient was seen at the facility, that facility may not have had an electronic health record, or the facility may not have started documenting in the electronic health record. But once facilities are documenting in the electronic health record, your file doesn't go anywhere. It's within the EHR system. So at the end, Chandra is going to give you some contact numbers, because for that person, I would really want to get you sorted out because there may be a little more involved in solving your issue. So Chandra, when you're done, I want to have that person have the contact numbers, or I can also give you my contact number. So in the morning that you can contact me so that I can get you sorted out, because I would want to confirm first if the facility that you are talking about actually has an EHR system, because if they don't, then they would not have your digital record, but I would need to confirm that so I can give you the correct answer and the way moving forward.
Thank you for that. And Mr. Major, I think that was you who had that question. Feel free to send us your contact information. We can also reach out to you directly. So I know a question that's in the chat that's speaking to medical certificates. Would a medical certificate be posted on your electronic health record stating that you are in good health? And if so, would this be acceptable by organizations within the country?
So in the format that you're talking about, a medical or a health certificate, that isn't the format that is within the patient portal. So it does have your visit summary, but the physician from the electronic health record, the physician is able to document a medical certificate and is able to print out the medical certificate from the electronic health record to present to you. I wonder if that answers the question.
I think so. I think
so. So if they're asking from the patient portal, because if once you access the patient portal, it has your visit summaries, but you want to have the medical certificate in the format to say that I am in good health.
I'm in good health. Yes, that's what they're asking. Yes.
Right. So to get a medical certificate saying that you are in good health, that will come directly from the electronic health record, your digital record within the clinic. And you can simply ask the physician or call the clinic so that they can document and print off a medical certificate for you.
Thank you for that. There's a question that it's definitely it's a provider-based question. And I think it's good for us to reference this, especially now that we're having the conversation about electronic health records, the patient portal, and the relationship now between the provider and the beneficiary. And so, Sabrina, you can just touch on this question for me. The question asks, if I live on a family island, can I have a physician located in Nassau for telemedicine and a local doctor that I can see face-to-face?
So if you're on a family island where we have our NHI facilities, let's say like in Eleuthera, in Abaco, in Grand Bahama, and Exuma, and even in Bimini, if you live on any one of those family islands, we do have a physical NHI physician there where you can see that those physicians be assigned to any one of those facilities if you're on any one of those islands and be seen by that physician. However, let's say if you're on Rumkey, you can be assigned to a facility that's on any of the family islands that has an NHI physician, and you are able to be seen via telehealth. And in the event that you want to travel from Rumkey to visit that particular family island, you are able to see that person face-to-face.
Okay, thank you for clarifying that. I do definitely like that reference about being on an island where there's not an NHI provider that's currently assigned there, but you can still sign up for the NHI Bahamas program and have access to a provider on another island that is NHI friendly. And so thank you for that piece of information, Sabrina. That was definitely valuable. I know a lot of persons are asking, how can they get this information? Is it available to us via PDF format? Just want to reiterate and remind all of our participants that we will be posting this recording and this session via our social media channels, particularly on our YouTube channel and our Facebook page. In a few moments, I will also be posting our contact information slide. And you can also feel free to call us tomorrow, send us an email, and we can provide this information to you in a digital format. You can also visit our website, and our website has a lot of resources as it pertains to different aspects of the NHI Bahamas program, ranging from benefits, the enrollment process, the electronic health record process, being able to access or to find out which provider is available, especially if you're trying to reassign. And so we just also want to make mention that reassignments can be conducted via telephone or email. And so if you currently live in Nassau and you may have moved to another family island that is NHI friendly, you can be reassigned to a physician on that island once the physician is accepting patients. However, you can find that information by contacting us via email, calling us on the telephone, visiting our website. Thank you so much again for logging on to our beneficiary educational session this evening. We just want to remind everyone on the call that we are promoting health and wellness. At the authority, we want to make sure that prevention is key, and we want to make sure that even if you may have been diagnosed with a chronic non-communicable disease, that there is a way for you to manage it and to also maintain your health. And so we have implemented 3 wellness activities. We have the NHI Power Hour, that's a free power fitness session that is offered every 3rd Thursday of the month. And for the summer months, we decided that we wanted to beat the heat. And so the sessions have been held indoors at the Holy Cross Parish Hall. We have also implemented the monthly beneficiary educational session similar to tonight. And so please stay tuned. Visit our Facebook pages, visit our Instagram pages, visit our YouTube channels, even pay attention to your emails. And that's how you'll be able to find out when the next session will take place and the subject matter. And then thirdly, ensure that your email address is properly documented and recorded at the authority, because you will be able to access our wellness newsletter, our quarterly wellness newsletter, which is sent electronically via email. Again, I want to post the channels through which you can contact us via email, via telephone. You can find us on social media on Facebook, Instagram, LinkedIn, and Twitter. And of course, you can also search us via the World Wide Web on our website. There is so much information that is posted on all of our channels. We answer all of our inquiries. So if you just send us a message, you can guarantee that within 24 hours, your concern or your query will be answered. And so again, I thank you for taking the time to log on to our call. There is a piece of information that was also just placed in the chat. If your contact information have changed, whether you would have changed your email address, your telephone contact, your address, your local address, or your mailing address, please reach out to us so that we can update your records and so that we can keep you up to date and informed about what's happening with the NHI Bahamas program and at the authority. Have a wonderful evening, everyone, and I look forward to you logging on to our call within next month. And please go out and share the word about the electronic health records, as well as the patient portal access. Download the Hilo app, log on to the Hilo, to the portal via the World Wide Web from your computer, your laptop, or your tablet, and practice. Go out and use the system so that you can become familiar with it. And if you ever find yourself needing some type of information or direction, you can reach out to us at the National Health Insurance Authority. Have a wonderful evening, and thank you again.